Health Spotlight, presented by Community Health Network.
In your Health Spotlight, a game changer in cancer research that saved one young woman's life.
News 8's Lena Pringle has the story on how this young champion beat her cancer.
This year, more than 80,000 people will find out they have non-Hodgkin's lymphoma. It's a cancer of the lymphocytes, a type of white blood cell in our bodies. There are more than 60 types of NHL, and it can be difficult to treat. But now, a groundbreaking new treatment could change the game for cancer patients. Brooke Michael, number 12, has been a catcher for as long as she can remember.
I've loved it ever since I put the gear on for the first time.
Her mom and dad have watched every battle on the field and were concerned when Brooke's shoulder started hurting.
She called me one day when her and her sister were at pitching practice, and she was in tears saying she couldn't breathe.
Brooke was diagnosed with B-cell lymphoma.
She had a massive tumor on her chest. It literally was the size of a softball.
6 rounds of chemo and 29 rounds of proton radiation helped to shrink it, but the cancer was still there. That's when doctors at Nemours decided to try a combination of gene therapy and immunotherapy called CAR T-cell therapy.
For the children who are getting CAR T, it's kind of the last curative therapy.
T-cells, which are a type of immune cell in the body, are taken from the patient's blood. Using gene therapy, doctors reprogram the cells to attack cancer cells.
And so those cells go in the body and they proliferate and start to divide and attack any residual leukemia cells.
Studies show up to 40% of children who get it go into complete remission. It's worked for Brooke. 1 year later, she's back in the game and cancer-free.
It's just the best feeling. Being back on the field.
We were days away from losing our daughter, and now we're just back to watching her around the softball field.
The new cancer-killing CAR T-cells stay in the body for months, maybe even years, to provide long-term protection. CAR T-cell therapy is not without risk: infections, fever, low blood pressure, and neurological problems, just to name a few. That's why it's typically reserved for patients who have not responded to other treatments or whose cancer has come back. I'm Lena Pringle for Wish TV, wishtv.com, and like us on Facebook.